Hey guys, welcome back to Quick Nursing Shorts with Smita, and today I'm gonna take another topic which is again under digestive systems. So it is called gastroesophageal reflux disease, which we call it as GERD. So here I'll take my laser pointer. Okay, so before we go into the condition, first of all, I'll just like to um, give a brief about the anatomy. So you can see this image here. This is the esophagus, and right here is going our stomach down here. So in GERD, what actually happens? So it happens here, near here, where our esophagus ends and stomach starts. So we can see there is something right here, right? So many of you might know what is it, and many of you don't. Then I would like to just recall and tell the other students as well that this is called the sphincter, and this is our lower esophageal sphincter. So what does a sphincter does in our body? So if you see, we don't have only one sphincter, we do have two, three, four sphincter everywhere. So the major role of a sphincter is to hold or to open up when it is required, and to close and to get back in a closed position. So in this area we have this sphincter because we take our food through our oral cavity, and it goes through the esophagus, it advances into our stomach. So when the food is being taken and we swallow it, this sphincter gets loosened up, it gets open, and the food easily go into the stomach. So when the food is in our stomach and when we are done with eating, so this sphincter goes back in its natural state, which is generally looks like this, and it's a closed position. So this happens, and we don't have this acidity problem every time, right? So when do we have this acidity problem? It might be a bile reflux, or it's not always the GERD problem, but yeah, when GERD happens, then this actually opens up, or maybe it's loosen up. So the food content is actually going against the gravity, which goes upward, right? So yeah, then we'll be facing this acidity problem, and we might feel like the food is coming back to our mouth. Yeah, so normally it is closing up, and in this condition it gets opened. So this is basically what happens in GERD. So let's move on to the definition. Now the definition says that gastroesophageal reflux, it's a backflow of gastric or duodenal content into the esophagus. So GERD is normal in both adults and children. So it's not like that only children will have it or only adults can have it. But yeah, there are many risk factors which usually seen in adults. So yeah, it mainly happens in adult, but it could happen in children also, maybe because of some malfunction, or maybe if there is any abnormality during the child child's organ formation in the fetus, when it is a fetus. So yeah, it can happen in children or infant also. Now, the reflux word itself, it means regurgitation. It's a medical term, of course, and you can say it, call it as backflow. And we normally know how regurgitation is, right? Now, so I hope the definition part is very clear to you guys. So we'll move on to the etiology. Now, the causes of GERD, it could be, as I said, incompetent lower esophageal sphincter. When the esophageal sphincter loses its capability to close tightly after we take food, or when we are done having food, or in any other normal time when we are not having food actually. So then this GERD can occur. And then when there is a pyloric stenosis, so when the pylorus region is stenosed, or I will take the another session on pyloric stenosis, and you can get it very you will actually get it there itself. Okay, so I'll just give a brief about it. So stenosis is something when inflammation or some in after inflammation only something happens, right? Like during the healing process, and then it gets stenosed. So you can just google what stenosis is. Okay, and then motility disorder. What is motility disorder? Motility means the food movement, of course, the food movement or the bowel movement, when there is any disorder related to that, then this could happen. And the incidence says that reflux seems to increase with aging. So why does it say it increase with aging? So yeah, the major reason which you will actually relate, that a human gradually when advances in age, then our skin changes, right? We get wrinkles on our skin, and our body uh, get through a lot of changes throughout the our adult period. So we take kind of foods which is not actually good, but we do. So everything goes, and then during our older period we may face so many problems, and we can see all the diseases are generally happening in old age. So yeah, this was the etiology. And one more thing here in this GERD, it's not happening because of bacteria. So this is not a bacterial infection. This is something which is wrong with your sphincter and then ended up having GERD. And now we'll be seeing the clinical manifestation, the signs and symptoms. So first of all, the pyrosis, which is very normal, right? So when we are having food back into our mouth, or when we are having um, this that bile, the sour taste in morning when we have it, or sometimes we may puke it out. It looks like some yellowish thing. So yeah, it gives a burning kind of sensation. It's the same way if the food is coming back to our mouth, just try to think how burning sensation we'll be feeling, because we eat spicy food, we eat sour, we eat every kind of food, right? So the burning sensation will be happening in the esophagus because it's coming back to the esophagus and then into our mouth. And then dyspepsia. Dyspepsia is the difficulty in drinking. So yeah, one more extra noted thing I'm gonna tell the freshers, that if any word is having this suffix dys, anything, if you see dys, it means difficulty. Okay, pepsia means drinking, so it's difficulty in drinking. Then indigestion, yeah, obviously, like if the food is keep on coming back and it's not going actually, because this peristaltic movement happens in our stomach, right? So the food from stomach, it has to go to the intestine, because absorption and digestion takes place throughout our digestive system. So it just get over in stomach, but yeah, digestion and absorption keep on taking place through our stomach, into the large intestine, small intestine, yeah. So another thing is regurgitation. Obviously, the person will be having the symptom of regurgitation. They will say that I feel like I'm regurgitating back my food, whatever I'm eating. Dysphagia, yeah, again dysphagia. So phagia means eating, so it's a difficulty in eating. Then odinophagia. Odino is something related to your again some discomfort. Okay, so if you see Ordino written in front of anything, then it means discomfort. So yeah, it says that difficulty swallowing. The person will feel like it's because we when it's just take a very general example. When we vomit, okay, when we puke, so what happens is that we feel like there is a sore in our throat area, right? We feel like there is a sore, and whenever we eat or drink anything, we say like, oh, it's very painful, it's very painful. So in this case, same thing happens. There's a difficulty in swallowing, there is a pain on swallowing. And then hypersalivation, same way, right? Food is coming back, so same thing happens in vomiting. So when we feel like to vomit and you're experiencing nausea, okay, just a feeling of vomit, you will be having this hypersalivation, right? So saliva will be keep on making in your mouth and you'll be keep on spitting, right? So yeah, the same thing happens in GERD. Then esophagitis, like your esophagus are gonna inflamed. In the previous class I told you itis word says inflammation. So yeah, the esophagus will be inflamed here. And these symptoms, there are some other symptoms which may also mimic those of a heart attack. Okay, the person will say I'm experiencing pain, the pain is going from here to there, or patient will say like I'm feeling a heartburn kind of sensation or something. So we may they may not understand and we think like, okay, the person is aged, or they might be having a heart attack, or they might have an episode of heart attack. So but as I said earlier, that we have to do our diagnosis and the person has to go through the diagnostic criteria to get identified what disease condition he's actually having. Okay, so moving on to the other thing, that is assessment and diagnostic findings. So to evaluate any damage to the esophageal mucosa. So if you guys remember in our last class in gastritis, I told you that when the our stomach mucosa lining is damaged, so we do endoscopy. So usually whatever happens in our upper GI system, we go for a endoscopy, and whatever happens in our lower GI system, in diagnostic we'll be doing a colonoscopy. Okay, so here we might be asking the patient to swallow barium, and then we'll just take a radiographic picture of it, so we can see how the barium is going and where it is getting stuck, and the movement, and we can see where the actual problem is. And then we can have a pH monitoring also to see the acid reflux degree, that how much acidity is there, like how much alkalinity is there, because the HCl is actually alkali, right? So bilirubin monitoring also we need to do, because the bile is also keep on reflecting back. So yeah, this is all the diagnostic findings. I hope it's clear to all you. Now the management. So management, we are having antacids or histamine receptor blockers. So here the person is facing issue like acidity, right? So we will give them antacids to subside that symptom. Then protein pump inhibitors. In this we are using some medications which will actually decrease the release of gastric acid. Okay, so lansoprazole and all we'll be giving to the patient, or rabeprazole will be giving the patient. So this acid, like acid formation is actually acid, the acid which releases before having food or after having food, it will get decreased. So somewhere it will help out in the disease condition. And then we can give them prokinetic agents. So what these prokinetic agents are doing actually, they will just accelerate the gastric emptying. How they will do it, see, if when the person doesn't have passed motion for 1 day or 2 day, patient is complaining for constipation or something, so we give them um, tablet or medicine or syrup, right? So here also we are doing the same thing. So the person takes, and just to prevent it not to come back, so we are giving them maybe a motilium or bethanacol we'll be giving them, and then domperidone. So these are the medicine to um, empty the gastric content as soon as possible. Now, surgical management. So here, if the medical management is unsuccessful and it's not working for the patient, then surgical intervention could be necessary. And majorly, we go for a fundoplication. So fundoplication is, it's a wrapping of a portion of the gastric fundus. So when you study anatomy, you can see where the fundus is actually located. Okay, so we are going to take that portion, okay, the gastric fundus portion, and we will wrap it around the sphincter area of the esophagus. So what happens here, we are actually the contractility of sphincter, we are just trying to bring it back to the normal state by doing so. So fundoplication, it may be performed by a laparoscopy. So it's not going to be a very big procedure. So we can just perform a laparoscopy and have it done. So it will make a small incision in our stomach, and then they will perform the surgery. So this is about surgical management. Moving on to the nursing management. So yeah, nursing management. So this is a condition where nurses can't do much, but the major thing is health education for us. So we are gonna play a major role in explaining the condition to the patient, or the patient take care, like whoever takes care of the patient. So patient carer also should know what the patient is going through. So this says that teaching the patient to avoid situations that decrease lower esophageal sphincter pressure or cause esophageal irritation. So we're gonna teach them the situations where this can be avoided. So how it can be avoided actually? So patient is instructed to eat a low fat diet. So why do we say to have low fat diet? Because the high fat high fat diet, but it doesn't get digested easily. Okay, so the person will be facing so many issues in digestion, and it's gonna remain in your stomach for a long period of time. So in regurgitation process, it's like person is already experiencing regurgitation, and then if they keep on eating high fat diet, so it's gonna worsen the condition more. And the next thing is to avoid caffeine. So caffeine also is not good in this condition, so we'll ask them not to eat much of not to take much of coffee. If the person is a coffee lover also, then we need to tell them why it is important, and what all the things he can do to avoid the caffeine. Now, avoid tobacco, beer, or any other drink. So tobaccos and beer, the um, there are people who will be having tobaccos and all, and they do have problem in their oral cavity. Okay, the oral cavity will be eroded, and esophagus will be eroded, or maybe there will be some problems. Okay, so the mucosa lining will get eroded because of that. So they have to avoid all these things. They have to avoid alcohol and avoid milk. Again, indigestion, milk doesn't digest well. So even in when the person is having diarrhea, we don't give them milk. We don't recommend them to have milk. Say that do not have milk or tea or coffee to avoid. So any food which is containing peppermint or spearmint. Okay, so peppermint and spearmint, it's a spicy thing, right? So the spicy thing also they need to avoid. And then carbonated beverages. Why do we tell that carbonated beverages to be avoided? Because when we take carbonated beverages, usually we burp, right? When we burp, sometimes the food also comes back, and many of us has experienced it, right? Because I used to take a lot of carbonated beverages, and I know that yes, it usually the food comes back, or the minor particle will come back. So the patient need to avoid all these things, and you have to explain to your patients that these foods are like restricted for a while until he gets better. And then we go to, okay, so there is something else too. Okay, so to avoid eating or drinking 2 hours before bedtime to maintain a normal body weight, because these patients will be facing problem with eating. They may be overeating or they might be under eating, so we have to tell them to avoid eating and drinking before bedtime. Now I'm going to tell you why this, because see, as I said that in GERD condition, it is happening actually against the gravity, right? So even when the person is in sitting and standing position, they might be having this, that the food is coming back. Okay, they might experience. So just think, the patient has the not patient, any person had food, or they had a glass of water or maybe a glass of milk before sleeping, and when they sleep, so generally we sleep in a straight line, like in a supine position, right? Or maybe in a left lateral or right lateral position, and there are people who sleeps in prone position. So what happens here, the chances of food coming back and the chances of the gastric content to come back into our esophagus and our mouth, it's more. So we tell the patient not to eat or drink before bedtime. Now, to avoid tight fitting clothes, again, when you wear a tight fitting cloth, you will experience like, oh my god, my food is not getting digested, and I feel like indigestion or something. And if you guys have ever experienced this, that whenever we go outside to have something in a good restaurant or something, and then we feel like eating a lot, but we might have over something very tight, and we can't just loosen it up, right? In public, so we feel like, oh my god, if I would have worn a loose cloth, I would have eaten very well. Yeah, so tell the patient to avoid tight fitting clothes. Now, to elevate the head of the bed on 6 to 8 inches, okay, to ask the patient to sleep, maybe sleeping in a phallus position, okay, just the head elevated so the food doesn't go against the gravity upward. So we can just let the food go down. So with so here we are actually taking the gravity help. Okay. Now to elevate the upper body on pillows, the same thing that we are putting some two or one or two pillow under patient's back, and we ask them to sleep like that to avoid the condition. Now, yeah, the last topic is the last heading is nursing diagnosis. So in nursing diagnosis, we know it's something related to digestion and food, so imbalanced nutrition. So you can just blindly write this nursing diagnosis in all your digestive system disorders, that imbalanced nutrition less than body requirement, and there could be imbalanced nutrition more than body requirements. Acute pain related to damage to the mucosa. So the mucosa is being damaged, the person will be experiencing pain. Risk for aspiration related to gastric reflux. So there is gastric reflux, the person will be on the more, there is more chances of having aspiration. And then deficient knowledge related to the disease condition, person doesn't have proper knowledge, and then they might think I had a heart attack, I had a mini heart attack or something, and they will unnecessarily get anxious and very worried about their condition. So need to give them proper knowledge about the condition. And then anxiety related to the treatment management. Once we say a surgery, you know, the person gets frightened, right? So they will get anxious, they will get worried about that. Oh my god, I have to go to through a surgery. So here the nurses has to work on their anxiety, they have to teach them. So you're gonna teach your patients about the condition well, how I have taught you here. So this is all. Okay, so thank you for watching, and if you have any queries and or there is anything I have left behind, you can just comment down and ask me. I'll help you through. So have a good day, enjoy and study well.